Hello, welcome to the BRCA Boss. I am Dr. Jamie Pribyl. I'm a doctor of physical therapy, and today I wanted to talk to you guys about what I am doing to prepare for my surgery. So once again, I am having a bilateral mastectomy with DIEP FLAP reconstruction. So what that means is they're going to be taking the fat and tissue from my stomach and implanting that into my breasts. So with that, from a physical therapy standpoint, there's a lot that I have been doing to get ready for surgery. So I want to go in as healthy and as strong as possible in this surgery. However, I am a little bit on the thinner side. So when I first went in about a year ago, my doctor said that I had enough stomach fat tissue to implant into my breasts, but that I'd be lucky to get what I had at the time, which, to be perfectly honest, I'm very small-breasted. So I kind of just jokingly actually asked him, I said, well, is it okay if I gain weight? And he kind of gave me a smirk and said, well, we don't really typically recommend women to do that. And I get where he's coming from. He doesn't want someone to go and sit down and gain a bunch of weight and go into this very long, extensive surgery unhealthy. And with that being said, when you do this, this is your tissue. So when you gain weight, your breasts will get larger. And when you lose weight, your breasts will get smaller. However, I belong to a couple Facebook groups that have a lot of women that have been through this. So in case you are not a member yet, I would highly recommend you look into the DIEP FLAP support group, as well as BRCA Sisters Connect. And then I think there's BRCA 1, BRCA 2 support group. All of them are phenomenal. The women there are super supportive, and I've gained so much information from there. So this video is kind of my way of paying it forward. Anyways, so a lot of those women I had asked, and their doctors actually told them to gain weight so that they would have a better chance of having more breast tissue after the surgery. So I kind of took from that, and I've gained about 10 to 15 pounds. When I first went in last, I think it was last March, I was weighed about 135 pounds. And so now I think I weigh 147. But I've been really smart with how I've been gaining weight. I still work out. I still eat relatively healthy. I'm just eating more, and when I'm at my thinnest, I actually have to work pretty hard. I really watch what I eat and make sure I don't consume a lot of sugar. I don't consume a lot of carbs. Not a lot of processed foods. Of course, I've been trying to avoid that anyways, just because I am BRCA1 positive, and I've been trying to eat very healthy to try to prevent myself from getting cancer. So, for the past 4 months, I think I've just kind of been eating. I just haven't been careful on what I'm eating. So I've been eating a little bit more carbs, kind of picking up on the sweets. We just went through the holidays, and it's worked out well for me. I've also just been doing a little bit less cardio and more strength training and lots of yoga. So that kind of leads me into the main thing I wanted to talk about today, which is fascia. So fascia is our connective tissue, and it's very, very important when it comes to rehabilitating ourselves after surgery. So fascia is our connective tissue. The best way to describe it is that three-dimensional spiderweb-like material that is in between two chicken breasts. When you go to pull it apart, it's kind of sticky and it pulls apart. And it holds those two chicken breasts together. That's fascia. However, fascia exists throughout our entire body. It connects every muscle to the other muscles. It surrounds our organs. It connects our muscles to our skin. Our skin is a type of fascia. So the best way to describe it and kind of show how it works is if I step back here. If my shirt was fascia, if I pull down here, you're going to see how my shirt's going to pull up on top. Okay? Now, if there's an adhesion somewhere, and I pull here, you can see where it no longer pulls up into my shirt over here. So if there's an adhesion somewhere, when I'm working physical therapy and I'm doing manual physical therapy on people, after surgery, I really want to get into where the scar is and do a lot of myofascial release and break up any adhesions, because if that fascia does not glide appropriately, I mean, if I raise my arm overhead and I have an adhesion here, I'm not going to be able to move, okay? So I want everything moving as best as possible going into surgery so that I can rehabilitate myself best coming out of surgery. So how do we release fascia? There are hands-on manual techniques, and like I said, yoga is really good for this. I really love yoga because it takes you into positions that you didn't even know that you were tight in, and they really take you to the extreme. So they do a lot of rotation, they do a lot of extension. It's also strength training, and I mean, lots of core. Core is going to be really important for this surgery because, you know, they're opening up not completely the abdominal wall. They're not actually like cutting into muscle to go deep into the abdominal cavity. However, you know, it's going to be really difficult to stand up after this. So with yoga, I really appreciate the fact that it's strength training, it's meditation based, it really focuses on myofascial extensibility, and it's been working really well for me. I personally have been doing hot yoga. It kind of does do the cardiovascular, gets my heart pumping, keeps me grounded. I absolutely love it. Now, if you do not have access to yoga, then so my next video is going to be a lot of stretches that I think will help women getting prepared for this surgery. We really want to make sure that our chest is able to be opened up and that our tissues in our stomach are as loose as possible, because basically they're going to do a small incision and then they have to go into the breast, and it's kind of like looking through a tunnel in order for them to remove all that breast tissue. And if your fascia is really tight, it's going to be hard for them to get in there and see. So if we can release that fascia to kind of just give them a little bit more room, that's going to be really helpful in the surgery. Also, with the abdominal incision, so they are going to cut, you know, from here to here and here to here, and then all of this is going to come together. So I'm going to be in a forward flexed position, and my doctor actually recommends for me to be in that position for about the first week because they don't want that incision to open up. But I feel like if my tissue's really tight, I'm really going to be bent forward. But if my tissue's a little bit looser, maybe I'll be able to have a little bit more give and stand up a little bit straighter. So that's how I'm preparing for that. And like I said, the next video is going to give you a lot of stretches and things like that so that so for people that don't have access to yoga and things like that, I would like to be able to help them. Now, in regards to the meditation component of yoga, I think that is excellent. And on top of that, I have been reading this book right here. It's called Prepare for Surgery, Heal Faster. It is by Peggy Huddleston. In here, she talks about talking to your body and preparing it for surgery. She did tons of research that showed that people who had less anxiety going into a surgery came out with way better results. They healed faster. They used less pain medication. So I think they used half the pain medication compared to others, and they got out of the hospital 1.5 days earlier than someone who did not do this process. And so what it is, she gives some meditations. You really focus on relaxing and you visualize your positive outcomes. So there's different stages right when you come out of surgery, later on when you've healed and when you're doing something that you love, and then way on down the road, like a year or two out. And I think there's so much value to that, you know, our tissues really hold a lot of our tension, and if we're stressed and anxious, we're going to be really tight. So if we're relaxed, we can, you know, deal with the surgery quite a bit better. So I'm going to go ahead and put the link down below. You can buy this on Amazon, or you can actually go directly to her website. I think it's called Prepare for Surgery, Heal Faster is the website. So I hope that is all valuable information to you guys. And like I said, I would like to follow up with some exercises. I'm really focusing on strength training. I would like to go over that with you, some stretches, a couple different things like that. So If you are interested, please click below and subscribe to my channel, and there is a little bell that you can actually click on that will let you know when I post. And please let anyone out there know if they are interested or are going to be going through a similar surgery. Thanks, guys. See you soon.